I'm Dr. Jamison Spencer with Cadwell Therapeutics. I'm going to show you how to reline the silent sleep to make it more retentive. Now, sometimes we might reline the silent sleep completely. Like, for example, with this appliance, the jaw position, let's say that the jaw position is not where we want it. And I want to show you something with this appliance. I'm going to have the patient put that in. And we made this with the +2. Now again, +2 implies that the lower jaw would be 2 millimeters forward of the upper jaw, or the lower incisor to be 2 millimeters forward of the maxillary incisors. And go ahead and close down. And if we look at the position there, that is obviously not forward at all. As a matter of fact, it's maybe a little bit back from end to end. And how that can occur, open, close, so is pretty simple, that if the patient brings her head up a little bit, then that will still be parallel, but the jaw position is backwards. So go ahead and bring your jaw forward a little bit. Let's go ahead and take the appliance out. So we need to be really careful. I mentioned this on the fitting video, that when the patient closes, bring the jaw forward, that we are looking here and making sure that that is in that anterior position, that her head is down, and that the bite gauge itself is parallel to the floor. Otherwise, again, with the head coming up a little bit more, so the more her head comes up, then that goes back. So bring the head down, now it's forward. So just those subtle movements of the head or the gauge can end up with a result that is not what you expect. So open. So we may have assumed that, oh, we fit this +2 and we don't check in the end, and this is actually retruded the jaw ever so slightly and could be a negative consequence there. So we want to always go ahead and pop that in. Check after we fit the appliance to make sure that the bite position is correct. So in this case, again, we'd have her open. We see that that is actually posterior. We would then open and pop out all of this material, just rip it out and start over. So start over and get the position correct. Now, let's say that we were happy with this position, but we're not happy with the retention. Pop that in. And if you open, most of the time, this is going to be what happens, is it will come off of the maxillary teeth pretty easily, close, but it will open, stay on the mandibular teeth, and that's exactly how it happens in Jenny. For most patients, that's plenty, and we don't need it any tighter than that. Some patients will have a feeling that they want it tighter. I've not had too many experiences where they feel they want it any looser, but every once in a while you'll have a patient that wants it a little tighter, or just their teeth are shorter. Maybe they have a lot of wear on their teeth. There's just nothing to grab onto. This would also be the case in younger people. In children, you may be using the appliance and they really just have nothing to grab onto, so you may need to reline it. So to open. So what we're going to do in that case is we're going to add a little bit of material, a wash of the same GC reline material in on the teeth, on the occlusal surfaces here, and then fit that again. Now all I'm going to do is dry that off with a paper towel. Just make sure that there's not saliva in there. You could also blow this off or just dry it out with cotton pellets or whatever you want to do. The material is pretty good at bonding to itself. So we just dry that out. And then I'm just going to add the material right in where the teeth fit. And that's the only place I need to put it. Now, obviously, we have plenty of time to do this, because normally we're able to fill the entire tray and have still plenty of time to get it in the mouth. So with this, I'll just take my time making sure that I am getting that wash in there. And then we can either use the bite gauges again, but typically I will just put it back on the teeth and have the patient help me find that position, and it will be pretty obvious to her when it is in, when her teeth have fallen back down into the impression of the first fitting. So we're going to pop this in. Okay, go ahead and close into that. Just move that around until you feel that your teeth are going down all the way. And again, close your lips on that. She doesn't need to push out with her tongue or anything else in this case. Just bring the teeth all the way down in there. So you don't need to bite really hard, but just kind of bite down so that you know that you're into that all the way. Okay, so now we would just simply let that set up and then we will test the retention. Okay, so we've just let that set. Again, it's important that you let it set for the full time, since you are just filling in just the teeth area there instead of the entire tray. You're going to be a lot faster than if you're filling the whole tray. So let it set for a good 4 to 5 minutes to make sure that it's had time to set completely and to bond to the material. So we're going to go ahead and open. So that greater retention, you see that it's far more adapted to the teeth. This is basically a putty wash method of taking an impression. So all of the areas now where we have it interproximal, we would want to go in with a scissor and trim that up interproximally, trim up this excess here. So trim up all the areas that are interproximal, but we would keep the areas there that are grabbing around the height of contour of the tooth, and that's going to make it significantly tighter on the teeth. So that's how you reline it for increased retention. Again, I don't find that I need to do this very much because the appliance does not need to be that tight in the first place. It's nice for the patient to be able to open and have it pop off their maxillary teeth very easily. As soon as they close their mouth, they are going to keep it on their teeth anyway. One thing that I do have my patients do is put some Vaseline or bag balm or lip balm on their lips to help them keep their lips together while they're asleep, to have a nice lip seal, and that'll help them keep the appliance in as well.